Good morning and welcome. I'm Dr. Gligorovic. I usually sound differently I actually lost my good voice, but I will use this one. This is the best English I have, so I cannot claim this one, then I lost that. So, good morning and welcome. First of all, I'm so glad to see us here. We have more than 90 registered people, so that means the definitely need is here to learn more about addictions and talk more about addictions. We have, I think, wonderful panel of people who will talk today from different facets and try to explain our focus on addiction from different perspectives, from addiction psychiatrists, from counselors to pharmacists, from legal people who are really helping us with understanding the implementation of STOP Act on North Carolina and how much that will affect our practice and our daily prescriptions and ways how people are treated in North Carolina. I will just need to ask you please to turn your cell phones, or really at least put them on vibration or mute or whichever it's easier for you, because we'll be really distracting for the rest of us. Okay, and I will just have a couple of slides. I have no conflict of interest here, and really the whole world of addiction changed some 2 years ago when American Surgeon General Vivek Murthy published 416 pages report on health crisis talking about addiction. And he came with really staggering number at that time that almost 30 million people in the United States have a substance problem involving alcohol and drugs. And when we compare that to 29 million people with diabetes, you know, it's the same numbers. And we're talking about diabetes all the time. And we think that every other person in this country have diabetes, you know, and this is huge, huge, huge numbers. So we talk about those 26 to 30 million people in the United States with substance abuse, which is more than all Americans suffering from cancer. 14 million people in this country have cancer. This is double that number. Only 1 in 10 people receive substance treatments. So really, it's opioid epidemics. It's nothing else other than that. So what's happened 3 months ago? North Carolina came with North Carolina STOP Act, really to strengthen Opioid Misuse Prevention Act, to help, to regulate, to find a way how to fight epidemics in North Carolina, with strengthening oversight and tightening supervision of opioid prescriptions, to try to limit number of days which can be prescribed on opioids, what can be allowed, what cannot be allowed. We will have a whole lecture on this. We will have a whole lecture to go to the small details and really explain how this will affect our life, because this is probably the biggest act which happened in recent history, which will really change the way how medicine is practiced, what can be prescribed, what is oversight, what is not. So we will have a whole lecture on this. And of course we try to explain that will came with initial prescriptions for Schedule 2 and Schedule 3, how it's prescribed, what is the pharmacist's role, what is the nurse's role, what is a physician role, where the PAs stand in all of that, because what came with lots of details, and lots of people do not feel that they are knowledgeable enough what need to be done and how need to be done. So definitely rules change, and this is really made to update us on the rules and how we need to comply with that and provide our patients with best possible services. Physician assistants and nurse practitioners will need to have clinical consults with supervising physician. Of course, that is not completely clarified what the consults stand for and what are the rules of consults, how intense need to be. So second clarification will come on that. And then, of course, I will not talk about President Trump as President Trump. I will talk about President Trump about declaring a public health emergency 7 days ago, and how really that will change other ways how we practice. It's declared as a public health emergency. It's not declared as national emergency because that will make a difference in the way how the funds are used. Being a public health emergency do not allow us to use disaster relief funds for epidemics. Being a national public emergency will just allow to increase hiring and access to telemedicine. So it was one word of difference which made access to $42 billion just short. Welcome with that note, and I will have a major pleasure now to introduce Dr. James Berry,